Welcome to Wildcat Science with Mrs. Haugo. We are in Chapter 7, Part 6 on the skeletal system in the appendicular system. And we are doing a review of the hand. So we talked about there being there's 8 carpals, many little bones. And then the metacarpals, starting with the thumb, 1, 2, 3, 4, metacarpal 5. We talked about each finger having 3 phalanges, so 1, 2, 3, proximal, middle, distal, times 4, 12, and then the thumb just has proximal and distal to add up to 14 phalanges in each hand. And here is another view of the hand, looking at the radius and ulna that articulate with our carpals. Again, your lunate, hamate, triquetrum or triquetral, pisiform, trapezium, trapezoid, capitate, and your scaphoid. Your metacarpals, 1, 2, 3, 4, 5, starting at the thumb, and then your 14 phalanges, proximal, phalanx, middle phalanx, distal phalanx. Phalanx is 1, phalanges is multiple, adding up to 14 in each hand, 28 total. We are now moving down to the lower extremities of the appendicular skeleton and the pelvic girdle. The pelvic girdle protects the pelvic cavity and all of the organs there, and it supports the upper body on the lower limbs. Each pelvic bone develops from 3 parts: the ilium, ischium, and pubis. The ilium is this big flared elephant ear-shaped part of the bone. And then the anterior part of the hip joint and this part is the pubis, and then the posterior part of the hip joint and the bone is the ischium. There are a couple of things I want to point out here. This sacroiliac joint is a joint between the sacrum and the pubic bone, obviously the sacrum and the coccyx. We have a little bit of cartilage. This is the symphysis pubis, which is a joint between the 2 pelvic bones. So moving on to the parts of the pelvic bone, the ilium is the largest part, and it articulates with the sacrum, forms part of the hip joint, and lots of muscles attach here, and you can feel the iliac crest. If you were to feel your hip bones, that is the iliac crest that we talked about earlier with crests, and that's right up here is what you're feeling. This is the ilium. The ischium is the lower portion of the pelvic bone. It's part of the hip joint, and the ischium tuberosity makes up your sit bones. So if you were to put your hands under your buttocks and move your hip bones around a little bit, that pointy part of your butt is your ischium tuberosity, and it is a place where muscles attach. The pubis, and before we move on to the pubis, we'll just look at the skeleton. The posterior part here, that is your ischium. So the pubis is the anterior portion of the pelvic bone, and it is also part of the hip joint. And then, so that would be here, this anterior part, and then the 2 pubic bones articulate at the symphysis pubis right here, that little bit of cartilage right there. And the angle formed between the 2 pelvic bones is the pelvic arch. So this is the posterior view of the pelvic girdle, and we have the ilium, the iliac crest, the ischium in the back, and then in the front is the pubis, and then the sacrum and the coccyx. And then you can see that there is this opening where the spinal cord would go through, and all these openings for the nerves to go out and innervate your body. If you remember looking at this, the posterior view of the pelvis, there's so many nerves going through those foramens. So let's look at some other views. So here is the medial surface on the left. If you're able to cut yourself down the middle and then look at it from the middle of your body, you would say the ilium, the ischium on the posterior side, and the pubis on the anterior side. And there are a lot of our bone parts. We see a crest, a fossa, which is a depression, a spine, another spine, little notch for a nerve, another notch for a nerve, another spine, and the obturator foramen, which is a big hole for nerves to go through. And then looking at it from lateral view, from the side of your hip, again, the ilium, ischium, pubis, and you see how all three parts of that bone make up the hip joint, which has a special name, the acetabulum. We've got some spine, crests, and there's your ischial tuberosity, which you may have felt earlier. There are some differences between the male and female pelvis structurally, for the obvious reason that the female pelvis is designed to have a baby go through it. So the female pelvis is wider, you can see on the top picture compared to the bottom picture, more flared. The ilium has a more flared shape. The pubic arch is wider. The pelvic inlet, which is right here labeled as the pelvic brim, is wider, and the outlet, which would be on the inferior side, is also wider. And then the sacrum and the coccyx are shorter and less curved to make more room. So if you can imagine, this is where a baby's head would have to go through. We are moving distally down to the lower extremities or the lower legs. And the bones of the lower limb provide the framework for the thigh, lower leg, and foot and support the weight of the entire body. The first bone is the femur. It is the longest bone in the body, and it extends from the hip to the knee. We can see the femur here. The head of the femur is in the hip joint, and it extends all the way to the knee. So the head, like I said, articulates in the acetabulum of the pelvis in a ball and socket joint, and many muscles will attach to the large projections near the head. So you can see there are some large projections here near the head of the femur, and many muscles attach there through tendons. The distal end articulates with the patella and the tibia. So looking at the distal end of the femur, it articulates with the patella and with the tibia. The patella is also commonly known as the kneecap. It is a flat sesamoid bone, which is actually inside a tendon that passes anteriorly over the knee. And you can see the patella bone on the skeleton here. Okay, let's look at some pictures of the femur. We have the posterior surface and anterior surface, and there is the head of the femur, and then the neck of the femur, and then some of those large projections for muscle through tendon attachments, greater trochanter and lesser trochanter, and the gluteal tubercle. I'll let you guess which muscle attaches at the gluteal tubercle. And then coming down to the distal end, we have the lateral and the medial epicondyle, and then the condyle, the medial and lateral condyle, which articulate with the tibia. Also, the intercondylar fossa allows articulation with the tibia. And then the patellar surface articulates with the patella. Moving distally down from the femur is the tibia, and it is commonly known as the shin bone, and it is the larger of the two lower leg bones. And it is located on the medial side. And the proximal end articulates with the femur, and the distal end articulates with one of the tarsals, actually the talus. So if we look at our skeleton here carefully, we see that the proximal end is articulating with the femur, and that, I don't know if she's that flexible, the distal end is articulating with one of the tarsals, specifically the talus bone, and then there is a outside bone, a lateral bone, known as the fibula, which is a long, slender bone on the lateral side of the tibia, and it does not bear body weight. The proximal end articulates with the tibia, actually, not the femur, just the fibula articulates with the tibia, and the distal end articulates with the tibia and then also the talus bone. And then the ankle bone is actually the lateral malleolus, which is a projection on the fibula. I'm not sure I can show you that, but we'll try. Okay, so do you see the fibula ending down with the lateral malleolus? And that is what we would call our ankle bone. Fun fact, when I was a senior in track in high school, I had a stress fracture on my fibula, which usually does not bear body weight, but obviously with me it was, so I have some messed up alignment there. We're going to take a closer look at the knee joint. So this is a lateral view looking from the side. Here's the femur, and then the patella is inside of a tendon there, and the femur is articulating with the tibia, and then the tibia is also articulating with the fibula. And then this is a posterior view of the knee looking at the back of the knee. We can see the medial and lateral condyles of the femur articulating with the tibia, and then also again the head of the fibula articulating with the tibia. Okay, let's look a little more closely at the lower leg bones, the tibia and fibula. Up here at the top, we have the medial condyle of the tibia, lateral condyle of the tibia, and the tibial tuberosity. These are all projections where tendons and ligaments attach. There is the anterior crest, which is a crest where ligaments attach, and you can feel that crest in the front of your tibia, in the front of your shin bone. And then coming down, we talked about the lateral malleolus on the outside of the fibula, and the medial malleolus, which would be on the inside and on the tibia, is being called your ankle bones. We are continuing distally down the lower extremities to the foot. The foot is very important for supporting your body weight, all your body weight, and for mobility. The foot is actually very similar in structure to the hand. Instead of 8 carpal bones, there are 7 tarsal bones in each foot, and there are a couple I want you to know. The talus, which is this one up here, it forms a joint with the tibia, and this joint has a lot of freedom of movement. Go ahead and move your foot around and see how much it has. And the calcaneus is commonly known as the heel bone. It is the largest tarsal bone. And then there are more: navicular, cuboid, and then 3 cuneiforms, lateral, medial, and intermediate. There is a video I want to watch during class, and there are 5 metatarsals, starting with the big toe, 1, 2, 3, 4, metatarsal 5. And just like the hand, 14 phalanges. On the big toe, just the proximal and distal phalanx, but then the proximal, middle, and distal on all the other ones for a total of 14. So looking again at the pictures of the foot, calcaneus, the talus, the other tarsals, all 7 altogether, your metatarsals from the big toe, 1, 2, 3, 4, 5, and your 14 phalanges. And then that's a superior view. And then here is the lateral view, where it shows the talus articulating with the tibia. And then also your tarsals, calcaneus, talus, and then your metatarsals and phalanges. We're going to pause there. In our next video, we're going to talk about some bone disorders. See you then. Bye.